Scheduled an article, ma'am.
Okay. Okay, good afternoon, everyone. Today I'll be teaching all on the step of CPR. Okay, so you take out your this first aid practical copy. Okay, afterwards we'll have physiology. First, take out your first aid practical copy. Gayatri, please take attendance. Okay, at the end of the class. Okay, so we start.
Yes, ma'am.
Is the screen visible?
Yes, ma'am.
This is how you need to write in your practical copy, okay? The steps of taking CPR. There should be step in one side and the other one is rationally, okay? So I'll send you all this PDF and then you write it down. So what were the articles needed for taking CPR? Bubbly? Snee, what were the articles needed for taking CPR? Harissa, what were the articles needed? Palak, what were the articles? Parmita Dev Barma, what were the articles needed for taking CPR? I think I'm not audible, na? Let me ask Kostav whether I'm audible or not. Kostav, am I audible?
Yes, ma'am. Yes, ma'am.
Oh, that means they are just silent, na? Okay. Bubbly, tell me the articles that are needed to take CPR. Celeste, tell me what are the articles?
Endotracheal tubes of various size, an Ambu bag with mask, a suction tube or catheter, laryngoscope with different sizes of plates, nasal airway, oral airway, a bowl with gauze pieces, lubricating jelly, adhesive tape with scissors, local anesthetic drug, spray, gloves in cover, a kidney tray, a paper bag, masks of various sizes, local anesthetic drug, disposal syringes with needles, and intravenous set, a cut-down set, and a cut-down set.
Okay, very good, Celeste. Thank you so much. Okay, rest of you, what happened? I have asked you all and then you couldn't even reply also. Study nicely, your second session is coming, okay? Okay. So let us discuss about the steps of procedure, okay? The steps of procedure of taking CPR. So the first step is that we have to determine the unresponsiveness and we have to observe for spontaneous respiration. We have to palpate Keratic pulse and ask the victim, are you okay? So we have to determine unresponsiveness first of all, okay? And then we have to observe the respiration, whether the respiration is spontaneous or not. And we also have to palpate the Keratic pulse, okay? There are how many sides of taking pulse?
9.
Okay, out of 9, why do we need to choose this? Why it is written here, palpate carotid pulse? It can also have written other pulse, brachial pulse, radial pulse. Why I have written carotid pulse here? Why do we need to palpate this particular pulse out of 9? Anyone? I already explained this. Can anyone explain? Just say yes or no. Why you people are making the class boring? If you know, say no. If you know, say yes. If you don't know, say no. Done, huh?
No, ma'am.
Okay.
No, ma'am.
Okay, Kostov, explain to your friends. Why do we need to palpate this keratic pulse?
Ma'am, repeat the question once, please, ma'am.
Why do you need to palpate the keratic pulse? Where all other pulses are also available. Why do we need to palpate this keratic pulse? This is your homework. I already explained. It's not that the first time you heard all these things. Kitna bar bolungi main? Okay. What is rationally? Rational? Rationally means like this is the step, okay? Why are you doing this step? There is a rationally, okay? Why are you doing this? Oh, excuse me. So why are you performing this step? That is the rationally, okay? So why do we need to determine unresponsiveness, and we have to observe for the spontaneous respiration, and also we have to palpate corrective pulse, okay? And we have to ask the victim whether he or she is okay or not. Why? In order to prevent injury from attempting resuscitation of a person who has not suffered a cardiac or respiratory arrest. Because when someone is in the state of cardiac arrest, and when someone is in the state of respiratory arrest, then we mainly used to give resuscitation. Now we mainly used to give CPR because the heart doesn't beat anymore. Now that's why we used to give resuscitation. So we need to ask the patient whether he is or she is okay or not, whether his respiration is normal or not. We have to do this because by doing this, we can prevent injury from attempting resuscitation, okay, of a person. So that is for safety. Are you clear with the first point?
Yes,
Yes.
ma'am.
Okay. Whoever is silent now will explain this. What is there in saying yes or no? If someone is silent, again, we'll explain the whole step and procedure. Let me see who is perfect. Okay, number 2, call for help. In a hospital setting, call emergency phone number. Okay, so we have when someone is needed for resuscitation or he's unconscious, or if he's serious, then you have to call for the hospital setting for emergency cases, okay? And then the rationally is what? To activate mechanism for additional personnel. And number 3 is we have to place the victim supine on a firm, flat surface or use a board. Okay, you have to, before you perform the CPR, you have to place the victim in a supine on a firm, या फिर flat surface, या फिर board use करके you have to place it. Okay, by placing this, what will be the use of this? It will facilitate internal compression of heart. वो जो internal compression of heart, जो compression दोगे ना, it will facilitate internal compression of heart. Help करेंगे. Heart is compressed between sternum and heart surface. So your heart will be compressed between sternum and the heart surface. Okay. And then kneel at the victim side because the victim will be unconscious now. So you have to kneel down at the victim side. Okay. And this kneeling down at the victim side will allow performance of rescue breathing and chest compression without moving knees. Okay. Like no need to move the knees here and there. Okay. Like once you kneel down beside the victim, it will be very easy for you all to perform rescue breathing, okay, and also perform the chest compression. So that is why kneeling down at the victim's side comes under the step of CPR. Are you clear with the 4 point?
Yes, ma'am.
Okay. Okay. those people who are not responding, make sure that you are not responding, indicate that you are very interested to explain. You don't want to listen, ma'am, explaining, you yourself want to explain. So I'll give you all opportunity, don't worry. Okay, next. Open the victim airway. So now let us see how can we open the victim airway, okay? Because we should, before performing resuscitation, we should always follow all these steps now, which I keep on explaining. So place one hand on the patient forehead. I already explained this. We will place one hand on the patient forehead and we will apply firm backward pressure, okay? Means माथे पे एक हाथ रखना है, हाँ, माथे पे एक हाथ रखना है, and then you'll apply firm backward pressure with the palm to tilt the head back. So like you have to put the one hand on the patient forehead, okay? Firmly you will apply backward pressure, and then with your palm you will tilt the head backward, okay? This is how you need to do, okay? Then after that you have to place the finger on the other hand, okay? Because in one hand you are placing the patient, your hand upon the patient forehead. Now, in the other hand, what you will do is that in the other hand, you will then place the finger of the other hand under the bony part of the lower jaw near the chin. So under the, means in the bony part of the lower jaw, okay, that is near the chin, you have to place the other hand, okay? And then when you place the other hand under the bony part of the lower jaw near the chin, you will try to lift up, okay, to bring the jaw forward and the teeth almost to occlusion. So what is occlusion? What is occlusion? Any idea? Write it down in
No,
your
ma'am.
copy. This is homework. Write
No,
down
ma'am.
in your copy. Occlusion. Write down in your copy. This process, okay, this process, what will be the rationally? The rationally will be like, it will have in the rationally will be, it will have in opening the airway, okay, if you follow this process. And then next, grabs the angle of the patient lower jaw and lifting with both hands, one on each side, displays the mandible forward while tilting the head backward. The jaw truss technique without head tilt is the safest method for opening the airway in the presence of a suspected neck injury. So we have to grasp the angle of the patient lower jaw, patient ka lower jaw that you were like grabbing it only. Now you have to grasp the angle of the patient lower jaw, okay? And then lifting with both hands means you grasp the angle of the patient lower jaw, right? After that you try to lift, okay, with both your hands, one on each side, both your hand, one on each side, and then you have to displace the mandible forward, okay, while teaching the head backward. This is how you need to follow, okay? If you perform all this practically, then it will help you all to understand more now. So I think all this need to be explained practically, right, by seeing the demo. Do you think so?
Yes, ma'am.
Okay,
Yes,
because
ma'am.
when you just read it, I don't think you will be able to understand like properly. I mean, like you will get the meaning, but I think like viewing the image with our naked eyes will be more preferable for understanding, I guess. But you just try to know for now, because you are not physically present. And then CPR is something that cannot be shown through video, okay? It need to be performed like it need to be performed this physically, okay? कैसे मैं CPR वाला practically दिखाऊंगी? That is next to impossible. So it can be seen only, it can be shown you all only with the help of the dummy. Okay, next. Next you have to prepare for artificial respirations. So what is artificial respiration, Gayatri? Artificial respiration. शायद पता है artificial or permanent हो. Artificial means what? What is artificial? Any idea, Gayatri? If no, Birvashri will tell the answer. Okay,
Ma'am, artificial.
Okay, no problem. Birvashri, can you please explain artificial respiration? Birvashri, do you know the answer? If no, I'll explain.
No, ma'am.
Okay, so artificial respiration, no? See, this artificial respiration is the respiration that we give ourselves. We give ourselves. Okay, that is जैसे कि mouth to mouth resuscitation, जो हम बाहर से like खुद सांस देते हैं ना पेशेंट को, कैजुअलिटी को, तो उसको बोलते हैं माउथ टू मींस आर्टिफिशियल रेस्पिरेशन. जैसे कि माउथ टू माउथ, इसके माउथ टू नोज विद हेल्प ऑफ एम्बू बैग. ओके, ऑल दोस थिंग्स. मैंने आर्टिकल्स दिखाया था ना कि क्या क्या जो इंस्ट्रूमेंट और मशीन भी था जो रिससिटेशन, जो हम रेस्पिरेशन दे सकते हैं, ब्रीदिंग दे सकते हैं. So for mouth to mouth resuscitation of an adult, pinch the victim nose and ये भी मैंने सिखा लिया mouth to mouth resuscitation कैसे किया जाता है. Because when you perform CPR, in between, what you need to perform? You are giving a chest compression, CPR. तो उसका between में तुम लोगों को क्या करना है? Birvashri, Hyoda, Celeste, what do you need to do in between while you are giving a chest compression? CPR दे रहे हो in between. What do you need to give? Rescue breathing, right? Yes or no?
Yes, ma'am. Yes, ma'am.
Yeah, you are giving a chest compression, you are giving a CPR, so in between you have to give the resuscitation, ना जैसे कि mouth to mouth resuscitation, mouth to nose, ये सब दिया जाता है. That's why I told you all, ना there should not be interaction between between CPR, all those things I have told you all, ना. So you have to place one hand on the patient forehead and oh, so sorry. You have to perform mouth to mouth resuscitation of an adult, and then you have to pinch the. You have to pinch this one patient nose. Now I have already shown you all the techniques, so no need to explain in details about mouth to mouth resuscitation. Okay, and then after that mouth to nose resuscitation also you already know. Okay. So for an infant, place your mouth over the infant nose and mouth. So for infant, the infant is the baby and all that, the children, they're very small. So when you give mouth to mouth resuscitation or when you give mouth to nose resuscitation, the time what happens is that your mouth will have to cover both the infant nose and the mouth. You have to widen or you have to open your mouth in such a way that your mouth cover the infant nose and mouth. Okay, so that you have to give resuscitation. Okay, and then for Ambu bag resuscitation, Ambu bag तो मैंने दिखा भी दिया है articles में. तो Ambu को full form क्या था?
Artificial manual breathing unit.
Very good. So for Ambu bag resuscitation, now you have to use a proper size face mask and apply it over the victim's mouth. क्योंकि Ambu bag में जहाँ पे वो है ना face mask attach होता था ना Ambu bag में, उसका part भी explain किया था. तो वो जो mask है ना हर बच्चों के लिए और हर इंसान के लिए अलग-अलग सा size होता है ना. It will depend. So for Ambu bag resuscitation, we have to use a proper size face mask. Okay, when you give a proper size face mask, then only the resuscitation can be like successful. Okay, otherwise if the size is improper or it is too tight or whatever it is, so that will be like that. That will not work. Okay, means the resuscitation will not be successful in that condition. Okay, next. For artificial respirations with an Ambu bag in an adult, compress the bag fully for 2 breaths. So for artificial respirations with an Ambu bag in an adult, compress the bag fully for 2 breaths. इसका मतलब है when you give artificial respiration with the help of Ambu bag, ना in an EDA, we have to compress the bag. That particular bag जो है ना, जो मैं picture दिखाया था, you have to compress it. जैसे कि I told you ना, squeeze 2-3 means fully after means you have to compress the bag fully for 2 breath. Okay, compress the bag fully for 2 breath. That is squeeze करोगे, then you will say 2-3. Squeeze 2-3, squeeze 2-3, like that you will say. Okay, if you perform practically, you will know more. Okay, for Ambu bag resuscitation in a child, use too small compression of the bag. So when you do perform resuscitation in a child, okay, with the help of Ambu bag, then you have to use at least too small compression of the bag. Okay, why do you need to use at least too small compression of the bag? In order to prevent overinflation of the child's lung. This is number 6 point. Are you clear? How you need to prepare for artificial respiration? Mouth to mouth, Ambu bag, mouth to nose. Yes or no?
Yes, ma'am.
Okay. You have to observe again in number 7 point. It is mentioned that you have to observe for rise and fall of the chest wall with each respiration. So to mouth resuscitation दोगे ना, और mouth to nose resuscitation दोगे, बाहर से तुम उसको like सांस resuscitation दोगे ना, तो सांस दोगे तो you have to see whether the unconscious or the patient is like getting the getting the whatever resuscitation you have given na, whether he is receiving it or not. Okay, whether his breathing pattern is improved or not. How you will see? You have to observe his chest wall with his respiration. So जब एक respiration दोगे ना, तब उसका chest wall को देखना, क्योंकि हम जब सांस लेते हैं ना, तब हमारा chest wall it used to rise up ना, rise up down, rise up down. So in the same way, you have to check the chest wall. Okay, if lungs do not inflate, reposition head and neck and check. So अगर lungs inflate नहीं हुआ ना, तो जो patient जैसा position में रखा था ना, you have to reposition the patient. Okay, you have to reposition the patient neck या फिर head. Okay, this is to check for any visible airway obstruction. क्योंकि CPR दे रही हो, तुम resuscitation दे रही हो, okay, but still the chest wall doesn't rise up. Okay, then the time the lung do not inflate. Okay, the lung still do not inflate. At that time you will be very tense now, that what will I do, मैं क्या करूँगी अभी? So you'll be very confused. At that time you will try to change or reposition the patient. Okay, and you have to reposition the patient to check that whether there is any obstruction or what, and there is any vomitus or what obstruction. उसका मुख का अंदर में कुछ है क्या, कुछ घुस रहा है क्या, या फिर कुछ vomitus present है क्या, जिसका वजह से like उसका सांस नहीं आ रहा है. All those things you need to assess. And then next, suction any secretion from the airway. If suction is unavailable, turn the victim head to one side. So obviously मुख में तो हमारा everyday में कितना जो secretion होता है ना, तो when there is so secretion in the airway, okay, then what you need to do, suction. वहाँ पे मैंने कल articles का दिखाया था ना, I showed you all yesterday the catheter, okay, the catheter, the suction catheter, या फिर suction tube भी बोलते हैं, तो उसको मुख पे घुसाते हैं, उसके बाद with the help of the like machine or with the help of the ventilator, they use to suck out all the secretion that are present in the airway, okay, which block the airway. This is how it is performed. And in case if suction is not available, okay, suction is not available, then you have to turn the victim head to one side. ऐसा ऊपर नहीं रखना है, उसका माथा को one side पे रखना है. Okay, in this way it will unblock the airway. Okay, are you clear till here?
Yes, ma'am.
Okay.
Yes.
Only one is responding. The rest of you don't worry, okay? Just be ready for the
Yes, ma'am.
explanation. Okay, next. You have to assess for presence of Keratic pulse. So the next is क्या होगा? अभी हम Keratic pulse को assess करेंगे. Okay, suction भी कर लिया, obstruction ही क्या वो भी check कर लिया. तो उसके बाद हम क्या करेंगे? उसके Keratic pulse को check करना है. तो कैरेटिक पल्स को चेक करके फील करना है कि whether you can feel the कैरेटिक pulse or not. Okay, so these are the technique. The कैरेटिक pulse, this is the most central and accessible artery in children over 1 year. However, in an infant, the short stubby neck makes कैरेटिक difficult to palpate. Brachial artery is recommended instead. तो क्या होता है, जो हमारा कैरेटिक pulse जो है ना, ये when we are at the time when we are at the age of children ना, children होने का एज में ये फील होने में बहुत इजी होता है. ओके, लेकिन हम जब बड़ा होते when we get older and older, okay, at the time what happened is that we had a neck that is stubby neck. Our stubby neck, it used to make the carotid pulse difficult to palpate or difficult to feel. So जब like as time pass by, as years pass by, okay, we find difficult to palpate, but we can palpate, okay, because this is the only pulse that will help us to indicate that whether the person is still alive or not. And then when in children too, it is like this carotid pulse is more preferable, but in the adults and all, not this one, the brachial artery is also being assessed, okay. And then fingers are moved up the rib cage to notch when ribs meet the lower sternum in the center of the lower part of the chest. So our fingers are moved up, okay, up the rib cage to notch, to put it together, to notch, okay. Like fingers are moved up the rib cage to notch, means from rib cage to the point where they meet, okay. Fingers are moved up the rib cage to notch where the ribs meet the lower sternum in the center of the lower part of the chest. And the next is Gayatri, please take attendance. And then you have to place the heel of the hand on the lower half of the sternum. So all of you, I think you know what is sternum. So you have to place the heel of your hand, okay, on the lower half of the sternum, and place the other hand on the top of the hand on sternum, okay, so that the hands are parallel. So when we give CPR, okay, our hand always should be parallel. So we have to place the heel of our one hand on the lower half of the sternum. So sternum ka lower half pe we have to place one hand, and we have to place another hand on the top of the, okay, on the top of the hand on sternum, on the top of the hand on sternum, okay. Why? So that the hands are parallel. Hands को parallel रखने के लिए ऐसा procedure use किया जाता है, okay. And then fingers may be extended or interlaced, but should be kept off the chest. So our finger may be extended or else interlaced, but it should always be kept off the chest, okay. So this will reduce the risk of rib fracture during compression. So fingers को हमेशा वो है extended में रखना है, okay, or interlaced, but should be kept off the chest, okay. क्यों? क्योंकि ये हमारा जो रिब्स है ना, ये फ्रैक्चर होने में रिड्यूस करता है during compression, when we give compression, okay. Next, we have to loop the elbows, maintain we have to loop the elbow, maintain the arm straight and shoulder directly over hands on the victim's sternum. Okay, we have to loop the elbows and maintain arm straight. So elbow को देखना है, उसके बाद we will try to maintain our arm straight, and shoulder, हमारा जो shoulder है, it will directly over hands on the victim's sternum. Okay, and then after that, compress chest 40 to 5 centimeter. After that, compress chest for 80 to 100 times per minute. Okay, and then you have to ventilate lungs with 2 slow rescue, and then reassure the victim after 4 complete cycles. So these are the procedure you need to by heart, okay? ये सब by heart करना पड़ेगा, नहीं तो practically जब perform करोगे ना, समझ में नहीं आएगा ये. Okay, next, number 11. While resuscitation process, simultaneous efforts are made to obtain and use special resuscitation equipment to manage breathing and circulation and provide definitive care. So while resuscitation, now we have to proceed this simultaneous effort. Okay, process simultaneous effort are made to obtain and use special resuscitation equipment to manage breathing and circulation, and we have to provide definitive care. Next, for infant, this infant and all these things we will discuss in the next class. This infant, these children, okay, infant children, and there is some sign of effective resuscitation, and there is also some signs of ineffective resuscitation. Sign of effective resuscitation means as resuscitation effort continue, the resuscitation must decide whether the attempt to re-establish the patient recirculation are effective. For resuscitation effort to be judged effective, at least one of the following sign must be present. Okay, so let us see what are the signs of effective resuscitation. Okay, there all this, at least one of the following sign must be present bola for sign of effective resuscitation. जैसे कि constriction of the pupil, okay, whether the pupil are constricted or not, and then the key sign that brain is sufficiently oxygenated. So you will get a sign, okay, whether the brain is sufficiently oxygenated or not. Okay, then this seen keratic pulsation with its cardiac compression. So after giving its cardiac compression, you can feel the keratic pulse or pulsation. Okay, and then blinking upon simultaneous simulations of the eyelids. So blinking also is sign of effective resuscitation can be seen. Breathing that begins spontaneously. Suddenly the patient begins to breathe. So these are also the sign of effective resuscitation. And the movement and struggling, the patient is moving and struggling. This is also the sign of effective resuscitation. And decreased cyanosis. So cyanosis means bluish discoloration of the skin. So this also will decrease because now the patient is like finally going to heal now. That's why. Okay, next, signs of ineffective resuscitation. There are some factors that are responsible for ineffective resuscitation, okay, which include the following. Incorrect resuscitative techniques. So incorrect resuscitative technique, heart is drained of its blood by hemorrhage or cardiac tamponade, and then blood supply to the heart is obstructed by the presence of pulmonary embolus, means blood supply to the heart, okay, it will be obstructed by the presence of pulmonary embolus. The pulmonary embolus present होने का वजह से there will be obstruction in the heart, okay. And then there will be a severe chronic lung disease. Severe chronic lung disease has destroyed lungs capacity to oxygenate blood. These are the signs of ineffective. It means you are giving a resuscitation, but the resuscitation is not working. It is ineffective because there is a severe chronic lung disease. Okay, the victim is having a severe severe chronic lung diseases. Okay, which destroy the lungs. That is why even after giving resuscitation, also it will not work. And the lung are filled with vomitus as a rescue of aspiration. So, agar lung vomitus se fill hua to, then also there is a signs of ineffective resuscitation. So these are the signs of effective resuscitation, and the other one is the signs of ineffective resuscitation. So I told you all that it is a little bit of boring. Okay, it is a little bit of boring because you are not performing this practically enough, so you might feel it bored. But try to memorize it, all these simple point. Okay, just try to memorize it. Are you clear, all of you?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Just write down nicely. I will be sending you all the notes now. Okay, so just copy in your practical copy. Don't you remember to write this in a first aid practical copy. Okay, ye first aid practical copy. Many people used to have confusion. That's why first aid practical copy में अच्छी तरह लिखना. Okay, so that when you come back to the university, and if I let you perform among your friends also, like by looking the procedure or just by reading the procedure, you can practically perform it upon each other. Are you clear, all of you?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay.
Yes, ma'am.
The next class will be very interesting because next class will be physiology practical. Okay, and I will be teaching you all about the pulse, which is very important for your this one for for your daily assessment. Okay, whenever we go to hospital, the first thing that we check is vital signs. तो pulse क्या है ये जानने का means pulse क्या है ना ये वाला जानना बहुत जरूरी है, because when you try to take temperature you can't check only temperature, you have to check pulse also, you have to check respiration. इसलिए तीनों को एक साथ बोलते हैं TPR. कभी कभी हॉस्पिटल में भी ऐसा लिखता है कि प्रोसीजर फॉर TPR एक साथ लिखता है. Are you clear, all of you?
Yes, ma'am.
Yes, ma'am.
After my video conversion is over, I will inform you all when to join again. Okay, but be online.
Okay, ma'am.
That's all for now.
Okay, ma'am.
Okay, thank you everyone.
Thank you,
Thank
ma'am.
you, ma'am.
Ma'am. Thank you, ma'am.